Thanks everyone for taking the time today to learn about our latest ODMAP project, the over-the-counter layer. So our hopes for this layer, it will provide additional context and guidance for agencies conducting overdose prevention and response interventions in their communities as we seek to expand our understanding of available harm reduction tools. So to carry out this project, we partnered with a national consumer group with a few of their staff attending this webinar. So we're excited to see how this type of data can be used to support public health and public safety efforts to mitigate the overdose crisis. So, and also a big thanks to our IT team and our ODMAP team who worked to develop this layer. So we'll get started. So on the agenda for today's webinar, we will first introduce and demo the new OTC layer. And then we'll discuss new ODMAP features during the demo included in the recent release. And then we'll touch upon the naloxone saturation layer phase 2 expansion. So opioid overdose reversal medications, or ORMs, are safe and effective tools for someone experiencing a drug overdose. Expanding access to these medications is paramount, with the FDA approving naloxone for over-the-counter use in March 2023, while all states currently have naloxone access laws in place. However, access and availability to these harm reduction tools, of course, varies across different regions. While the naloxone saturation layer currently focuses on the availability and saturation of publicly funded naloxone kits at the county level, it's also important to understand opioid overdose reversal medication trends from other access points, especially since they have become an integral component in overdose reduction and prevention strategies across the country. Therefore, under the umbrella of harm reduction and building out onto the naloxone layer, monitoring opioid overdose reversal medications emanating from other access points will help us understand trends such as retail sales, such as cost per unit, building a more comprehensive understanding of how these medications are accessed and available, and also their relationship to suspected overdose events and other naloxone or opioid overdose reversal medication streams. Therefore, the over-the-counter layer will provide monthly overdose reduction medication sales data to ODMAP users in near real time. So for example, we just received the previous month's data, and we have that on the map that we will demo for you, representing April data. As you can see, the layer can be accessed from the layer's legends icon on the right of the national map. It's displayed as a choropleth or color-coded map layer showing the range of units sold during the most recent month. As you can see, we chose a purple color ramp for this layer to contrast with the other layers on ODMAP. The layer does not require any data submission by users. ODMAP partnered with the National Consumer Group to make this information available. In terms of coverage, it's predominantly available in the continental US. It's currently not available in Alaska, Hawaii, Puerto Rico, or other US territories. Now, as you can see, over-the-counter sales data are depicted by these unique geographic boundaries. They're called precision areas. We'll discuss this shortly, as you've likely never seen them before, and it's just a lot to kind of visually digest. So to reiterate, the purpose of this layer is to complement publicly available naloxone data included in the naloxone saturation layer, in addition to the other layers and information contained within the national map. So how the layer works. It includes the range of the number of opioid overdose reduction reversal medication units sold by precision area and the average cost per unit. This way you can compare the average price per unit sold in the nearest precision area in your area to the national average during the same time period. In precision areas where naloxone information is unavailable, the national average price per unit will be provided. Precision areas with no data, these areas represent those with no available data due to either sales or as a result of the data sharing guidelines established by the consumer group, which is all means to protect retailers from being identified. This layer is updated monthly and will include sales data from the previous month, which I had already stated. And being as these data are on ODMAP, that the OTC layer follows established ODMAP data sharing guidelines as well, and is not meant for public dissemination. So this new concept of precision areas, well, what are they? They're custom boundaries that represent over 2,200 geographic areas in the country and track any products sold by retailers. For this layer, we are tracking these opioid overdose reversal medication, or ORMs. Retailers include grocery stores, convenience stores, pharmacies, big box retailers, and liquor stores across the US. They're based around zip codes, but they're expanded to meet these data standards established by retailers. Yeah. So we'll switch now to the demo. So I'm going to stop sharing and bring up the ODMAP. Okay, so to start, I'm using the training site, so these don't necessarily represent real data that we'll be going through here. But I want to start off by reviewing two of the key new features on the latest release. One of those being the naloxone kits chart from the naloxone distribution and saturation data. So you can access this chart on the left. It's on the, it's on the very far right here. And it shows monthly counts of naloxone. You can toggle them on or off depending on the region. You can select a certain area to really zoom in, but the data are going back to December of 2023. And as we continue to receive more data and onboard sites, we'll be able to build out more data points within this chart and the layer. And so the other main feature with the new release is I have here currently the recent spike alerts layer across the country pulled up. And so one of the new features is the ability to reorder layers or stack them on top of each other in different ways to help you visually analyze the data from the map. And so if we zoom in, we can see if I turn on the saturation layer for and focus on Michigan, and you can see the saturation layer covers up, of course, the recent spikes layer. So if I move this, it's a nice way to put this on top of the naloxone saturation status layer. And so you can stack that here. If you click here, it'll zoom in on this particular county. And then if you click, it will tell you again, like the naloxone saturation status and the type of overdose spike that's occurring. And so that's the new feature where you can move these around as they see fit. You can put points like ODMAP suspected overdoses on top of, again, these Choropleth county layers in order to like not have them buried. So it's an exciting new feature that we rolled out in the recent release. And so I'm going to pull up another layer here. Hopefully it'll load. It went blank. Okay, just need a second here. I'm just going to refresh. And so I'll provide an example. We can talk about the saturate or the over-the-counter layer here with an example. And so we have the map visualized across the country. And you can see here the number of units. The range is broken down by 0 to 4, between 5 and 20 units, 21 and 50, and greater than 50. And the grayed out areas indicate no data. And so as it goes from lighter shade to darker shade, it indicates more units being sold over the previous month. So currently on ODMAP, the over-the-counter data and the naloxone saturation data both represent April 2024. And so we'll go through an example with Northwest Montana to look at a rural area and how the OTC layer can supplement our understanding of publicly available naloxone with regional over-the-counter sales data. And so we will toggle these on and off and stack these on top of one another. And so zoom in here. And so we see, we click here, we have this precision area. It covers, in this case, it overlaps nicely with 7 counties in Northwest Montana. That's not always the case. Again, we're dealing with custom boundaries that are based on zip codes. So there's not always going to be a nice overlap. So, but in this case, there is. And as you can see, in April, there were between 5 and 20 units sold with an average price of almost $45. And so meanwhile, in this 7 county region, we can see in terms of saturation, about 3 out of the 7 counties reported saturation. I believe when you total these, there were almost 1,000 kits distributed. So it provides a nice contrast of how much overdose reversal medications are being sold with a retailer versus what's being distributed from public funding. But that's one way you can layer those two in particular. And then another example, and hopefully it didn't freeze, but it probably did. So I'll reload this real quick. Apologies for the technical issue there. But another example we can focus on is in Kansas. And so by looking at recent overdose spikes, so as you can see here, indicating a recent spike in Reno County, Kansas. So as we then say, okay, this is a nice example of looking at overdose incidents and spikes compared to overdose reversal medications and naloxone that's available in the community to see how much resources are there, potentially how much needs to be allocated. And so looking at this, we would add on the naloxone saturation. Again, keep in mind, of course, this incident in terms of the spike happened obviously more recently. So keep that in mind, but we are looking at April 2024 naloxone that was available in this case. So when we click on the saturation status, add that, and we look at this county, we can see in April, there were 116 kits distributed, being over that minimum saturation rate. So in terms of, that access point, that, stream of naloxone, it deemed to be saturation. When we put on the over-the-counter layer, I'm going to move this, we can see that this county largely fits into this precision area here. But this precision area is very large. It covers, the majority of Southwest Kansas and West Kansas. And we can see over this entire area, there was reported, less than 5 units sold. You can see the average price there. Meanwhile, we could see how many kits were distributed from those publicly available sources. So it gives, again, a nice contrast in seeing what's available from where. Yeah. And then, so those are just a few ways that you can use this layer. Again, a lot of the emphasis recently as we've rolled out these new products is to layer and just bring in extra data sources. We've seen with the add a layer feature, you can go and just add different types of layers to your mapping to bring in more context and understanding to what's going on the ground. So I'll stop that there and go back to the PowerPoint. And so just to recap, OTC layer, we're looking at monthly opioid overdose reversal medication sales data. Again, it's a little different from what we're used to, but we're all kind of new to this concept and learning. The information that is included, again, we're visualizing the number of units sold, the range of the number of units during the most recent month. In the pop-up window, you get the precision area ID, report year, report month, and then that range again, an average price. On the right, I have the QR code of our one pager, which is on our odmap.org/resources site. It's located at the bottom. And then we also just briefly talked about the new features with the new ODMAP 4.7.0 release, namely how you can reorder map layers. You can move those around to stack them how you would like, and what helps, again, visually look at the data. Also included the naloxone kit distribution chart. So we were talking about that, having that ready during the webinar earlier this month when we released the saturation layer. So with regards to pivot to the naloxone saturation layer expansion, following the webinar, we've had a lot of interest from sites. So we've really enjoyed working with them to work on onboarding them onto the site. West Virginia was the latest being added to the map, as you all can see. So please reach out to us if you're interested in participating in the saturation layer. We'd be happy to talk about what that entails, and what that looks like. So yeah, I'll leave it at there. We can take